I want to say, first of all, thank you all for being here today. And I'm very grateful to stand here with Nadine Baker, an incredible woman, mother, grandmother, and a cancer survivor. We're here today because Scott Moe and the Sask Party, under their watch, people are literally dying waiting for care in this province. Right now in this province, cancer patients are dying before they get treated. Some are dying waiting for a test. And others have died before even seeing a doctor. Clearly, this is absolutely unacceptable. And there's no doubt that this is jarring, but this is the truth. This is the true state of healthcare under Scott Moe and the Sask Party. And it's the truth that's laid out in a memo from the Saskatchewan Government and General Employees Union that we're sharing with you today. In this memo, a nurse wrote, and I quote, "Patients have died before even being seen because physicians could not physically take any more on in their day," end quote. Another nurse wrote this, "Patients have died waiting for treatment due to the overwhelming demand and lack of available staff." They went on to say that treatment errors and delays are common, and they're common because of the high workload. Now, you'd think if you were in government and you knew this was going on, that you would understand the urgency and you would work quickly to fix it. But no. Scott Moe's Minister of Health saw this memo. And for 6 years before that, the Sask Party heard the alarm bells from nurses on the floor. He heard it from doctors. He heard it from healthcare workers, and he heard it from patients. And they did nothing to fix it. Nothing. Things have actually gotten worse. Now, finding out that you may have cancer, we often hear from patients that this is one of the worst days of their life. But what is so much worse is waiting with the knowledge that you might not get the care that you need. Of knowing that right here, outside the cancer care clinic, there are treatment options available that could save your life, but you can't get them because Scott Moe and the Sask Party have put them out of reach. This is a disaster, and it's a disaster that Scott Moe and the Sask Party have created. It's Scott Moe and the Sask Party who must answer to the families who lost their loved ones before they ever got the care that they needed. And it's up to all of us, every one of us in this province, to come together and put an end to this crisis in our healthcare system. Now, this election, you have a choice. You can vote for more of the same, more delayed tests, more long wait lists, more overworked nurses and doctors and healthcare workers, and more unseen patients dying before they get the care that they need. Or you can vote for change. And I'll tell you this, we're hearing from people every day, louder and louder, that people want change. Our healthcare system needs change. And this memo is just another reason why we need it. Saskatchewan, it's well past time for a change. And we're here because we have a plan to deliver. We have a plan that will stabilize and begin to fix healthcare by investing directly and working with those on the front line. We'll hire more doctors and nurses and healthcare workers to deliver the care that Saskatchewan people need. And we'll change the culture of healthcare in this province to keep the folks who are putting in the work today in our hospitals and healthcare centers in our healthcare system. And we're going to invest in the next generation of healthcare workers by giving Saskatchewan people a path to learn and work right here in our province. And we're going to do all of this because we know that when you staff up, you take the pressure off the system. This is how we're going to cut wait times. This is how we are going to save lives. Our plan will invest over $1 billion in healthcare to change things for the better. No more waste, no more corruption, no more spending on insider deals while Saskatchewan people are left to suffer. No more chaos in healthcare from Scott Moe and the Sask Party. An Saskatchewan NDP government will ensure that healthcare decisions are made in the best interests of Saskatchewan people, not in the best interests of politicians. On October the 28th, I'm asking for your vote. Together, we can get us out of last place in healthcare. Together, we can change a government.
Hello everyone. My name is Nadine Baker, and I'm here because I want change. I'm someone who is at high risk for breast cancer. My mom had breast cancer at the age of 48. So I know that I need to get very timely, regular checkups to prevent the same thing possibly happening to myself. In March 2023, I noticed some cancer symptoms, and I talked to my doctor, and she told me I needed to get a mammogram right away. That didn't happen. It took almost a year to hear from the people who were supposed to book me for the diagnostic mammogram. The regular breast screening program doesn't look at you once you have symptoms. So when they called me, they told me this January they didn't have an appointment for me. And that was 45 weeks after the referral. Instead, they asked if I would possibly go out of province, and I agreed. I wholeheartedly agreed. But at that point, of course, I looked for help. Wait times like that are not acceptable to me. I could have died while I waited. I could have died without even being diagnosed. And I was worried sick. So I spoke out, and I ended up getting an MRI rather than a mammogram. But I know I was one of the lucky few to make headlines to get my health care. Now I'm stuck in another cycle of waiting again, with no answers and no end in sight. I know I need to get tested often to make sure I don't have a cancer. Normal wait times for breast cancer screening treatments should be 3 weeks. Under Scott Moe, women like me are left to wait more than 5 months or longer. And so I ask you, how many women have to die from a completely treatable cancer before the current government takes the necessary steps to make all the testing and treatments available in a timely manner? I'm deeply concerned. After reaching out and going public, I had numerous friends contact me to tell me they're waiting. They've been waiting long, if not longer, for their screening. And in addition, one confided in me that she was waiting for a biopsy, and she'd been waiting weeks for a biopsy. And another had been waiting months for her mastectomy. Something needs to change, and that's why I'm here today with Carla, to speak out and call for that change. Thank you.
I'd be happy to answer any questions you might have.
So I'm just wondering, where was this briefing note obtained from? And you said it's been seen by the minister. How are you sure of that?
So there was a meeting with the minister, is our understanding, on September the 10th. And on September the 20th, this memo was sent both to Minister Hindley and to our healthcare critic, Vicky Mowat.
From the SGE? Okay.
That's right.
So I guess how would an NDP government approach and deal with the widespread issue of short staffing that's reported in this stuff?
The number one thing has to be an effective retention strategy for the healthcare workers that we already have in our healthcare system. Again, this memo is relatively recent. But the concerns that healthcare workers have been raising, that we've been raising in opposition, go back many years, over 6 years. I know in 2019, before the pandemic, we were raising concerns about the number of people in the healthcare system who were leaving, who were looking at early retirement, or who were just eligible for retirement because of age. We've not seen an effective retention, recruitment strategy. And you know, the truly frustrating thing, watching people in this province not getting care that they need because of short staffing, is this. Healthcare workers, like these members at SGU, like the nurses union, like physicians and healthcare workers across this province, have not only been bringing forth their concerns, have been proposing solutions for years, but what we hear time and time again, that those solutions are falling on deaf ears. You have a government that waves their 4-point plan around. It's the least effective plan in the country. They don't even acknowledge that there's a problem. And again, today we see in black and white that not only is there a problem, not only have they ignored the solutions put forward by healthcare workers, people are literally dying without getting the treatment they need, because we are not seeing a government that is making decisions in the best interests of patients. We're seeing a government that consistently makes decisions based on their own needs, and you know, they were reluctant to even suggest, or even acknowledge that there's a problem. There's so clearly a problem in this province, on front after front in healthcare, and you have a government that won't even sit down with those healthcare workers to start the urgent work of turning this around.
If elected, and you're given the keys to this very broken system, it's not like you necessarily have the opportunity to gut the whole thing and start over. How are you confident you can bring it around in time quick enough to actually make change? Because these things will obviously take time, and time is the issue, especially for people who are
Yeah, we're going to have to go fast. And I mean, this is the work that we've been doing over the last number of years. Again, not just talking about the problems in the healthcare system, but building those solutions with those on the front line. I'll tell you right now, and I would say this to anyone in the province, there is not a magic wand, but there is a sense of urgency, and there are solutions that have been put forward for years by healthcare workers. And the number one thing we need to do in this province is stabilize the existing healthcare workers in the province. We are losing people more than any other province, leaving the profession, leaving the province altogether. People across all classifications in healthcare retiring early or dropping down to part-time. One of the first things we need to do is ensure that we're offering those full-time positions. Half of the postings right now in this province for healthcare are less than full-time. This is it's incredibly frustrating to know that the government, won't even do the simple things like show up and talk to nurses, let alone work with them on a nursing shortage task force. Promises after promises, but worse and worse delivery of healthcare for people in this province is dangerous. This is not safe. And again, we understand the urgency. We have a willingness to work, to do the hard work of sitting down with healthcare workers and starting the important task of retaining those that we have. We cannot afford another 4 more years of Scott Moe and the Sass Party and their ineffective treatment, their disrespectful treatment of our healthcare system, because it is a system in crisis. We need to treat it with the urgency that we see in front of us today. Sorry?
Like, what targets do you plan to set if elected to make sure you're on track to fix the system?
I mean, as I said, the first thing is retaining the workers that we have as far and as fast as we can go. Assessing where the most critical areas are, where the blocks are to treatment. Like we've got concerns in diagnostics, we've got concerns in pathology, we've got concerns with family doctors. When you get a cancer diagnosis in this province, 1 in 6 people don't even have access to primary care. There are a lot of fronts that this has to be fought on, and again, this is not going to be made. These changes. The scope of the changes that we need to happen in this province aren't going to be made in small rooms in the legislature like we see too many times. These are going to be built with those on the front line, those in the system currently, in communities. Solutions will look a little different from community to community. There are challenges right across the healthcare system in Saskatchewan right now, but the challenges faced in Regina are different than the challenges faced in La Ronge. The challenges faced in Radville are different than the challenges faced in Meadow Lake. But the one thing is consistent. Well, 2 things I'll say. The lack of staffing and the lack of respect and willingness to work with frontline healthcare workers that we see in the province right now. And again, this is why people are calling for change. That's what we are putting on the ballot this year.
With some of the private offerings that are available, I think through MRI scans, surgical centers. What's the NDP's plan there with healthcare? Do you plan to still work with those systems?
So Nadine laid out very, very clearly, when you are waiting with cancer, when you're waiting in pain, you only want to get the care that you know that you need. And I've heard people say, I would be willing to do anything to get it. What we want to see is increasing capacity in the public system here at home so that people don't have to pay out of pocket and fly out of province to get that care. Care that is unattainable for many, and care even for those who possibly can afford the time or afford the out-of-pocket expenses, would rather be home. If you're going to get a cancer diagnosis, you would rather be home with your support system. You'd rather be home with your family. I don't need to be going for a wasp bite. You'd rather be home around your support system than in a hotel room in Calgary, like we recently heard from a couple who've been through this experience. This isn't about This isn't about ending that. This is about ensuring that we start to increase the capacity here in the system, that we're not losing more healthcare workers to clinics in Calgary out of province. Well, our healthcare workers in the publicly funded, publicly delivered system here are burning out.
Laid out about 7 steps. What step do you think is going to be the most difficult?
Just going through the steps. I don't think, as I said, any of it is going to be particularly easy. I do know what the first step has to be, and that is stabilizing the healthcare workers that we have in the province right now. One of the easiest things, one of the most effective things that could be done and should have been done, frankly, over the last 6 years, is for this government or for anyone who's making healthcare decisions to sit down with those on the front line and understand where the problems are, understand why we're losing so many healthcare workers in this province, and listen to their solutions. I mean, it's remarkable. I've had the opportunity to tour the pathology lab here. I've had the opportunity to speak with healthcare workers right around this province. We have smart, dedicated professionals in this province who know the system well. They know where the problems are, but they also know where changes need to start to deliver better healthcare, to retain more healthcare workers in the system. That doesn't cost this government a thing. It costs us so much, all of us, when they refuse to do it. That's the first place to start. And again, I'm under no illusions that this is going to be a quick fix. I don't have a magic wand, but we know where we need to start and we know the urgency. This is a system worth saving. People deserve to be able to get care in this province. People should not be dying on wait lists without that care. We're going to treat it with the urgency that's needed, and we are going to work with and respect those healthcare workers. We hear you, we hear them. To them, I would say, we hear you. We want to work with you. Hold on, because change is possible.
So before we close, any questions for Nadine?
Yeah, I have one question. If you want to you mentioned hearing from friends that they were also waiting for cancer screenings. This document indicates that nurses raised concerns that patients were dying before even being seen.
Right.
How does that make you feel as a person who has had to experience that?
You don't sleep. I haven't had a comfortable night's sleep, gosh, for, over 2 years, because, if you're not worrying about yourself, you're worrying about your friends, your family. I have sisters, I have granddaughters. Yeah. It's uncomfortable. Yeah.
I just have another one for Carla, unrelated to health, but I'm just wondering what you think about Randy Weeks. You look to be supporting the NDP. He's been posting about, endorsing your party. I'm just wondering what you think about that.
There are a lot of people in this province right now who are looking for change. Some of them perhaps have run for the Sass party before. Some people have voted for the Sass party. I'm hearing from people I heard from one gentleman recently who's 68 years old, has never voted our way, but he understands the need for change and is going to be voting for us this election. I would say to all people in this province who are looking for change that we have a plan. We invite them to look at our plan, our priorities, to offer relief on the cost of living, to start the hard work of fixing our healthcare system and respecting our healthcare workers, to invest in our education system, undo the damage that's been done, and to start to effectively address rising rates of crime. When people have the opportunity to hear our plan, when people understand the commitments that we've made, the transparency that we've presented, again, there are a lot of people who are voting for change in this election, and it's not. I won't presume to know how Mr. Weeks is voting, but I know that there are a lot of people who are looking for change right now. And days like today, when we look at the state of our healthcare system, it's not hard to understand why. One of the things I hear from people most often when they are telling me that they are going to change their vote this election is that they want to see decisions made to fix things. They don't want to just see bellowing and division. They want plans, a focus on actually making things better, not just political rhetoric, and that's what we've been really focused on.
Yeah, just following up on that, you haven't really brought up the gun allegations or some of the other criminal activity of the Saskatchewan party members. I'm just wondering why is it because this is what voters are looking for, is plans on healthcare, crime, that sort of thing?
I mean, there are a lot of things that we could dredge up that are already on the record in terms of how this government has conducted themselves, how they have made decisions. Our focus has been on showing people in this province that change is possible, acknowledging that they deserve better, and outlining the ways that a Saskatchewan NDP government would get to work and deliver on the things that they care most about. People that I hear from, and certainly myself personally, are tired of hyper-partisan, divisive politics that doesn't actually deliver results. We're focused on results. We're proud of the platform that we're putting forward. We've been transparent with our costing. And we are inviting all people in this province who are looking for change to get out and vote for that change on October the 28th.
And the Saskatchewan Party earlier today put out a news release. I don't know if you saw it or seen any of it, but just with some of your members on their past comments about taxes. It was Regina in 2019, Tulsa in 2013, and another guy up in Saskatchewan members. Just wondering if you had any response to that.
You know, we see increasingly tone deaf and, you know, out of touch, desperate actions on the part of the Sask Party in this election. And again, I think it's in contrast to the things that we're talking about today. We're talking about the fact that people are dying waiting for healthcare in this province. We're talking about the need to respect our healthcare workers. We're talking about putting solutions forward. They can, you know, they'll make their choices. I know whose interests we are working in. I know what we're focused on. And I know that people are looking for change. That's the appeal that I'm making to people in this province this election.
One more question from me. Royal University Hospital was recently given a notice of contravention for overcapacity issues. I'm just wondering, how would the NDP address these kind of ongoing problems with overcapacity at hospitals in Saskatchewan?
Well, I mean, again, the number one thing is addressing staffing. Looking at reforms to paramedic services, ambulance services. Once we have staffing in place and stabilized, reopening the ER at City Hospital 24/7 to reduce some of that capacity. Working to stabilize emergency rooms in the areas outside of Saskatoon, ensuring people have access to family doctors, primary care, so they don't end up in the emergency room. And again, this is an incredibly complicated system. But the solutions that I just put forward and we've been putting forward have been built with those who are working on the front lines. You know, it's an incredibly dire situation when you have nurses who are working in conditions with 350% capacity and they still feel that they need to, put out media releases or sound the alarm. They take that upon themselves as well. I want to say, healthcare workers in this system, they're not afraid of working hard. They understand that healthcare is busy, that, there are going to be days that are busier than others, but 350% capacity, no one can work in those conditions. What they are burning out, in addition to the working overtime, working short, the reasons they're burning out is because they feel like they have a government right now who's not listening to them, who's disrespecting them. And as we heard today, we saw in this memo, when they go home at the end of the day and they know that they haven't been able to give the care to patients who need it, they haven't been able to deliver the results that they want, that causes such distress for healthcare workers who got into the profession to help people.
On another topic, there was a recent overdose in Saskatoon while Prairie Harm Reduction was closed. So what's your party's stance on safe injection and supervised consumption?
We need to effectively address what is an epidemic in this province. The rate of overdose, addictions, and suicide as well in the province. Working with all of those on the front line to not only ensure that we have access to care and treatment, detox for people in the province, but that people stay alive while they're waiting for that care in the province. Again, this is Saskatchewan has actually seen the life expectancy in this province drop by 2 full years, the largest drop in the entire country. Well, we've seen a government who has effectively done nothing around not only ensuring that there's care for those who are actively addicted in our province right now, but to start to turn that around in our province. Part of our plan is to take the $20 million that the Sask Party has proposed to possibly put boots on the ground for the Marshal Service in 2 years, take half of that money to invest in frontline policing right now with existing police forces, and take the other half of that to invest in frontline mental health and addiction supports in the province.
So would your party, and if you're a premier support, could safe injection sites, a recovery model, or something else?
Well, right now in the province, we have unsafe injection sites right across the province. I mean, you see it in every community, almost every community in the province. This is about ensuring that we are not just approaching this problem from one angle, that we are looking at effective treatment, we are looking at effective prevention, we are looking at effective policing to ensure that we are getting tough on the people who are bringing poison into our communities, killing people in our province, and ensuring that people stay alive until they're able to access treatment. This is an issue that's plaguing communities right across this province, and it is not the time for divisive talking points. It's the time to dig in and actually find solutions so that our young people are not dying of overdoses in this province.
Okay, thank you, Carla.